Is everyone settling? Shall we start? Is Disney coming? Darna, can you contact him and see?
Rizni is with me. Here.
With you at the night?
Huh?
How is he with you at night?
We came to LRH, so we are going home together.
Okay. Ale, are you recording? Right. So we shall start. We stopped at question number 15. So we are starting now. Which of the following statements concerning routine and specific vaccinations are correct? So always there will be a MCQ on vaccination. Another small point that I just wanted to mention is that the MCQ base note document, right? The MCQ base note document is given in the drive. So go through it and identify which questions, right? Which questions are having the themes. So for an example, in the pediatrics MCQ, right? In the pediatrics MCQ, you will have certain questions which have a deliberate theme. So for the first question, you will have a theme of like, for an example, say nutrition, right? And that will be repeated over several years. So if you know the question themes for each question number, you can study those separate parts when you are getting prepared for the MCQ, right? So with that said, we'll go into the base note එක දැකලා තියෙනවනේ අර පාට ගොඩක් තියෙන traffic light එකක් වගේ. අලේ දේශබන්දු, you have seen?
Oh මචං අර මේ දාලා තිබ්බ මේකේ මේ repeat campaign එකේ දාලා තිබ්බා.
Yeah, can you share it දේශබන්දු right now in the group?
හරි මචං හරි okay හරි.
That is like the base template for making MCQs in pediatrics. So the first one is pentavalent vaccine in national program of immunization often includes acellular pertussis compound. This is false. We went through this earlier also. The one we have in the Sri Lankan national program is the cellular part. This has great immunity, but this produces great immunity in the recipient, but there is a small down play in this because there is increased risk of allergic reactions as well, right? So we have the whole cell pertussis vaccine. Children with uncorrected cyanotic congenital cyanotic tetracephalus require hospital admission for the administration of routine vaccines. True or false? Jarna?
Yeah, what did you say? Sorry, I am in. Can I answer you after 5 minutes? I'm about to reach home.
Sure. Deshabandhu, what do you think about the B stem? Do you think it's true or false?
Wait for me.
It's true, Macha. Right? Ale, can you tell the reason why it's true? Right. So right? Tough babies are at increased risk of infections. Why? They are immunocompromised. So if after a vaccine, if they can get reactions very easily, that is one reason. Actually, getting infections after vaccination is not the reason they are admitted each time they for a vaccine. The main reason is, have you heard of something called hypercyanotic spells?
Yeah. Oh.
So when hypercyanotic spells takes place in the field, if it takes place in the field, that's a medical emergency, pediatric emergency. So vaccination is a highly stressful condition for the children, especially children with heart disease. So that can precipitate a hypercyanotic spell in a tough child. That is why they usually admit the children before vaccination. Pneumococcal vaccination is a standard recommendation prior to undergoing cochlear implant procedure. True or false?
True.
Why? Why? Yeah, hip can very commonly cause acute otitis media, right? And this can infect the inner ear because in cochlear implant there is a connection between the middle ear and the inner ear. So sometimes if the infection spreads to the cochlear implant, you will have to remove the entire implant and discard it. So to prevent that, you need to give pneumococcal vaccination. Varicella vaccination should be deferred for a minimum of 3 months following a blood transfusion. True or false? Hello. This is true. All live vaccines are deferred for 3 months, right? Following blood transfusions. BCG vaccine is contraindicated in extremely premature babies at birth. What is extreme prematurity? At which period of gestation do we consider extreme prematurity? If I can remember, it's 28 to 32 weeks of gestation, right? So do we not give BCG vaccine? Ale? False. It is not contraindicated. Make a mahanda pula. BCG is not given for very low birth weight babies. True or false? BCG is not given for babies with mothers with active TB. True or false? ඉස්සල MCQ එක ආව මේක මම ඒකේ මතකින් කියන්නේ අලේ ඔයාට මතකද? BCG vaccine is contraindicated if the mother has TB, right? BCG in very low birth weight babies with ඒක තමයි ඒක මට හිතා ගන්න බෑ අතටම මචං. ඒක තිබ්බා හැබැයි අපි අර ස්ටෙම් එක හොයද්දී ඒක තිබ්බා මට මතකයි. Premature babies, extreme premature babies that are contraindicated. Now, where can you find the answers to these questions? I'm going to contraindicate here. Very low birth. Oh, very low birth that is contraindicated now. Now, where can we find the answers to these questions? What is the resource that we can use?
අර ගයිඩ්ලයින් වගේ එකක් ඉමුනයිසේෂන් එකේ කන්ට්‍රාඉන්ඩිකේෂන් එකකට දාලා තිබ්බා.
Huh? Jarna?
That national immunization guideline.
We can use the vaccine handbook or the SLMA vaccine handbook, no?
Okay.
So in that, there is a place which mentions vaccination. So I'll just cover the important things in the vaccination program because there will be a MCQ definitely from vaccination, right? So now in the EPI program, there are live vaccines and there are inactivated vaccines. Okay, now you all have to say the inactivated vaccines and the live vaccines. What are the live vaccines in the EPI program starting from the first one? What is the first live vaccine given? Rishni, shall we start from you? Can you tell all the live vaccines given in the national EPI? Hello, Rishni?
Yeah, I'm here.
Yeah. You free to talk or do you want some more time to settle down?
I can say all the live vaccines. MMR?
First, start from the first one.
Okay. Very first one. BCG?
Good. Then?
And
you can't take this longer.
OPV?
Okay.
And oral polio vaccine. We have JE.
Before that?
MMR?
Okay.
And JE? MMR, JE. After that we have that's all I can remember.
Is this all? Everyone else? What are the other common live vaccines given apart from the extended program of immunization? මේවා තියෙන්න ඕනේ හොඳේ. ඊවාග අලේ මොනවාද මේ ටිකට අමතරව තියෙන vaccines ටික live national EPI එකේ? national එකේ නැති commonly දෙන live attenuated vaccines මොනවාද අපේ? දන්නේ? මතක් කරපො පොඩ්ඩක්. varicella එකලයි. ඒක තමයි pregnancy එකේ දෙන්නේ නැති මේක. Right, now it's easy. Inactivated vaccines ටික කියන්න පුළුවන්ද? පිළිවෙලට. Okay. HPV live inactivated. Sure that. Oh, live name. Tawanat. Tetanus. Like a toxoid. Right. So now, that day I mentioned that you have to have at least 4 weeks gap between 2 live vaccines, okay? And inactivated vaccines you can give sequentially. Okay? Missed inactivated vaccines can be given sequentially, but you need at least 4 week gap between 2 missed live vaccines. Understood? And then these rules are there in vaccination. Remember these, right? These rules are very important in vaccination. Number 1, children with fever do not get vaccines. That is first thing. And then after a seizure, even if it is a febrile seizure is not something dangerous, no? So even after febrile seizure, do not give JE. Do not give JE for 1 year. That is one rule. Second rule. Third rule, have at least 4 weeks after a steroid dose, after a corticosteroid dose of more than 10 milligram per day. More than 10 milligram per day ගන්න කට්ටියගේ ළමයිගේ corticosteroid dose එක ඉවර වෙලා සති 4ක්වත් ගියාට පස්සේ තමයි give live attenuated vaccines. Why? What are the diseases that corticosteroids are important in? Nephrotic syndrome. So they will definitely ask these questions, sir. They identify you as someone who knows in addition to what is being taught in the lectures. You can get more marks. And the other thing is, after IV rituximab, right? After IV rituximab, give live vaccines after 6 months of the last rituximab dose. 6 months of the last rituximab dose. Rituximab දෙන්නේ පොඩි කට්ටියට මොන වගේ conditions වලද? අලේ දේශබන්දු nephrotic වල දෙනවනේ. nephritic වල දෙන්නේ නැහැ. nephritic වල දෙනවා ඇති අපිට උගන්නන්න නැහැ. ඒකෙද දෙනවා. එතකොට anything else that you give rituximab for? JIA wala yana excellent.
SLE?
Actually also you can give rituximab. I'm just looking at the ones that they have mentioned in the guideline. And then something else is this: after IV immunoglobulin or a blood transfusion, give live vaccines, after delaying for 3 months. Right? What are the conditions where you give IVIG, Jarna? Good. Any other conditions? Jarna?
Kawasaki.
Yeah, Kawasaki we already know. Anything else?
Then thrombocytopenia.
Human variable, acute flaccid paralysis.
GB. Yeah.
Right? And then blood transfusions. What are the conditions which in pediatrics which give rise to repeated blood transfusions?
Thalassemia.
Yes.
Immune thrombocytopenia.
Will need at least 3 months gap between the vaccination of a live attenuated. These are for live vaccines, huh? Understood? Inactivated ones you can just give. Another Jarna, understood?
Yes, I did. And also another rule is do not give oral polio vaccine when the child is having diarrhea. Why? Yeah, excellent. Stools, it cannot establish in the villus border because it's a live virus, right? So these are the main ones, and then you need to know where the route of administration of different vaccines. Okay? Route of administration of different vaccines. Okay? So what are the routes that you know? What are the common routes that are present? Oral.
Any others?
IM. Intramuscular.
Subcutaneous. What is the only that is given subcutaneously? Jarna? Only one vaccine is given subcutaneously in the EPI. No, you all should know these things. Yeah? Subcutaneously in the sense intradermal. What is the only vaccine that is given? Excellent. Right, so there is a whole set of vaccines which are given subcutaneously, IM and intradermally, right? So know those different types. What are the vaccines that are given by each route? Guarantee. So the most important thing is you need to know these things in respect to a long case. Patient diarrhea admit to long case diarrhea again. They will ask now, okay, what do you do now regarding the diarrhea? How will you treat this patient with the vaccination when the patient is having diarrhea? Will you give the OPV vaccine if the child is having diarrhea? So they can ask questions like that. Understood? So I'm just checking whether about something about the pneumococcal vaccine, whether it is given for cochlear implants. Yes. So cochlear implants will be right? Okay. So we'll go to the next one. Which of the following statements concerning scabies infestation are accurate? A. Diagnosis is definitely confirmed by microscopic observation of Sarcoptes scabiei mite and its products from skin scrapings. True or false?
True. True. Skin cream.
How do you diagnose this? How do you identify the mite? You can do a microscopic observation. Any other observations? Have you heard this thing called dermatoscopic observation? Dermatology appointment they have this kind of this magnifying glass. So from that magnifying glass also you can identify the mite and the feces and so on. Understood? Topical cream should specifically be avoided in areas like the natal cleft and umbilicus. Natal cleft is between the buttocks, right? Umbilicus is the umbilicus, you guys know, belly button. Should it be avoided? False. The mite will go there and then live if you avoid it, and you will get the infection again. All close personal and household contacts should receive prophylactic treatment even if they are asymptomatic. True or false? True. Everyone should receive treatment. All household members need to be treated. The infection classically spares the spans and salts in infants. True or false? I don't know that actually. True that or another.
True.
Right.
True කියලා මේකනම් තිබ්බ මේ එක ඩයග්‍රෑම් එකක් තියෙනවා ඒකේ තිබ්බ.
කන්සයිස් එකේද?
නෑ. ඒකින්ද දන්නේ කන්සයිස් එකේ තිබ්බේ නෑ. ඒක බලන්න. ඉන්ෆරන්ස් ලගේ තිබ්බා. ඔව් ඉන්ෆරන්ස් ලග් කියලා තිබ්බ එකක් තිබ්බා. කන්සයිස් එක නම් නෙමෙයි මේ නිකන් මේ වෙන එක මම දැක්කේ. කන්සයිස් එක බලන්න.
Secondary bacterial infections of the excoriated lesions is a common complication. True or false?
True.
What is the common bacterial organism which leads to this infection of the scabies excoriation?
Is it Staph aureus?
It can be staph, but there is a much common organism that commonly causes this scabies secondary infection, and with it also causes a renal manifestation. What is that bacteria? Group A, yeah. Group A beta hemolytic strep. What does it cause?
Disney? Yeah. Yeah, ඒකෙන් එන්නේ infective endocarditis අනිත් එක මේ අර neonates ලගේ මොනවාද ඒකට කියන්නේ neonatal pneumonia, neonatal sepsis and also puerperal sepsis. GBS කියලා කියන්නේ ජින් වල තියෙන මචං අර from එක එහෙම ආවම dribbling එක ආවම අපි GBS screen කරනවානේ. So that is where group B streptococci comes into import. Shape them. I'm just looking at. So, do you guys know about scabies? So, do I need? Right. So, this is the thing. MCQ දානවා හරිද? Now this is applied knowledge. Applied වලින් තමයි මේ ටික ගහගන්න පුළුවන්. හරිද? Now you might not remember everything about scabies, but you can definitely get 3 stems from this MCQ. හරිද? So when you get scabies is due to the mite Sarcoptes scabia, right? And this mite burrows, which means it drills a hole into the epidermis. හරිද? And then it lays eggs there, and it also produces feces there, right? And this feces is allergic to the human skin, so because of that you get itching. When you get itching, you have long nails, and humans have long nails. The nails will damage the dermis, right? And when the dermis is damaged, these infections can go inside because the raw tissue is now exposed, not covered with epidermis, and they will get skin infections. So this cycle will go over and over again, right? Because the mite is actually hidden inside the epidermal tunnels. You can't really get the mite out. So the mite quietly lives, it proliferates, it lays eggs, it produces newborns, and then it repeats its life cycle. However, you are always getting itchy, and also because you are itching constantly, you introduce more and more infections into the skin. So for scabies, you have 2 treatment arms. The first thing is you have to treat the contacts. So how do you treat the contacts? You ask them to take the medicine. That is one thing that you can do. And then you have to also ask them to remove all the clothes they have, and you can ask them to boil the clothes in 100 degrees Celsius for about 5 minutes, or you can ask them to keep the clothes in a transparent bag in the sunlight for 7 days, right? Also all the mites will be dead, and then you have treatment for the scabies mite. You have different types of treatment. You have topical treatment, and you also have oral treatment. So oral treatment is the treatment that you drink, and then topical treatment is the cream, like the topical stuff that you apply. And then you also have to treat the secondary bacterial infection. Treat the secondary bacterial infection. What is the antibiotic that you can give to treat the secondary bacterial infection? Ale? Yes, excellent. Any other antibiotics? Something better than erythromycin? Hello? Amoxicillin can be given, no? Right? So so you can do topical, so you have to give antibiotics for the infection, especially the bacterial infections. And then meanwhile, you have to also give the patient topical cream. The topical creams that are available are number one, benzyl benzoate. Benzyl benzoate, usually you have the 25% local application, right? You ask the patient to apply everywhere in the skin, wait for 30 minutes, and then take a bath. You ask to apply everywhere, no sparing of any areas, right? And then you can also give permethrin, right? Topical permethrin cream. That is also a scabicide, right? 5%, right? And then yeah, so that is the main topical treatment. And then for oral treatment, you can treat with oral ivermectin. Right? Ivermectin is the common scabicide agent that is used. Right? So usually what we do is we give the patient oral ivermectin for 5 to 7 days with one of the creams and also antibiotic. And then we ask the patient to follow these precautions. Understood the management of scabies?
Yeah.
Yeah.
Yeah. So I am not very sure about neonates having their palms spared. I'll just check that now. Did you find it in the concise Deshavanda?
No, Arunaja, ඒක හම්බුන්නේ.
So it says, in short, warm and moist locations of the body are generally commonly affected. Unlike adults, infants may suffer from lesions over the scalp and the face. Lesions over the palms and soles also may occur. They have not mentioned that the palms and soles will be spared in children. I'm not very sure about that. So shall we leave it? So it's not that important also. You understand the diagnosis of scabies? That's more than enough. කවුරුවත් අහන්නේ නියෝනෙට්ස් ලගේ කකුල් වල ඇත්තලා එනවාද කියලා. ඒක උන් කතාවක් නෙමේ. ඒ ටික දන්න හින්දා we'll go to the next one. Shape the which of the following statements concerning congenital adrenal hyperplasia are correct? If untreated, it can be a cause of true precocious puberty. True or false? True precocious.
False නේ.
False.
True precocious එනවා එන්නේ නේද? ඒක false precocious වගේ නේද?
Yeah, why?
මේ pseudo precocious වගේ නේද? ඒක අර ඕකෙන් හදන්නේ මේ මොනවාද මේවා හින්දා
Yes, due to ectopic androgen production.
androgens.
You guys understand what is the difference between true precocious puberty and false precocious puberty, neither?
No,
Oh.
can you please explain?
No.
I forgot.
Pseudo precocious.
Yeah, can Deshapath explain? I think he knows better than me.
මම යන්තම් බැලුවේ ඒක අර මේ මොකද්ද මේ අර මේන් පාත් එකේ එනවා නම් මේ ඒක true precocious මේ hypothalamic pituitary
Describe to me, Jaharna.
Jarna that may normally it goes by the hypothalamic pituitary axis. It cause problem is called that true precocious puberty. In this condition, it's caused by the increased androgens and other hormones. No, then it says that it is pseudo precocious puberty.
Okay.
That's not
Okay.
on that part. The name like that thing I read.
Yeah, so basically, Jaharna, you have two precocious puberties, you get secondary sexual characteristics early than expected, right? So it can be due to two ways. One way, the GnRH secretion from the pituitary itself increases suddenly, and then the testosterone levels increase and you get secondary sexual characteristics earlier. That is true precocious puberty. Because true, why? Because the hypothalamic pituitary gonadal axis is what is getting activated. Understood?
Okay. Yeah.
And then pseudo precocious puberty is when you have an ectopic production of androgens or an ectopic production of a gonadal hormone like estrogen or androgen, estrogen in females and androgen in males, which leads to secondary sexual characteristics without maturation of the hypothalamus pituitary gonadal axis.
Okay.
You understood the difference, no? In true
Yes.
precocious puberty, the androgen axis is mature
Activity.
earlier,
Yeah.
but in the pseudo one, the androgen itself is ectopically produced without maturation of the axis.
Okay.
Okay. So we'll go to the next one. Serum level of 17 alpha hydroxyprogesterone is typically reduced in the most common forms. True or false? Yeah, increased. Why? Yeah. Again, මට මතකද hydroxyprogesterone hydroxylase එක තමයි deficiency එක එන්නේ. So then you get increase in this compound. Right? 21 hydroxylase deficiency is the most common underlying enzymatic defect. True or false?
True, right?
True.
True.
You're sure?
Yeah, it's true, right?
You're sure? I'll just check that. Deshibandu, did you see the concise textbook?
Yeah, I will read. මෙතන තියෙනවානේ the commonest is a deficiency of the enzyme 21 hydroxylase කියලා. Page number 383,
Right.
18.11 congenital adrenal hyplasia.
Page number 383.
Oh, first paragraph එකේ තියෙන 18.11 congenital adrenal hyplasia එකේ first paragraph එකේ last එක. The commonest is a deficiency of the enzyme 21 hydroxylase.
Yeah, which accounts for more than 90% of cases. And it is also derived in autosomal recessive. Autosomal recessive. So what is the diagnostic test? Diagnostic test is ACTH stimulation test, right? So that is called short synecton test. So that is the definitive diagnostic test. This is true. Chronic cortisol deficiency leads to hyperpigmentation due to ACTH deficiency. True or false? True.
True.
What does this ACTH cause? ACTH is very similar to melanotropic stimulation hormone, which leads to increased melanocyte production, which leads to hyperpigmentation. Understood? So 21 hydroxylase deficiency එක හින්දා වැඩි වෙන්නේ ගොඩක් commonly මතක තියාගන්න 17 hydroxyprogesterone, right? 17 hydroxyprogesterone. මෙහා තමයි වැඩි වෙන්නේ. It's not reduced, it's increased. 21 hydroxylase enzyme deficiency is the commonest enzyme deficiency. About 90% of the time, that is the one that is present. Understood? Shape neither. Shall we go to the next one?
Okay.
Which of the following factors are recognized as increasing the risk for child abuse and neglect? Child having intellectual disability. Common sense MCQ, common knowledge, general knowledge. Yes, these children are at risk for sexual abuse. Having extended family social support.
False.
False.
False. Living in a community that accepts or normalizes corporal punishment as a disciplinary method. True or false?
True.
Corporal කියන්නේ මේ punish කරන එක, ගහන එක ඒ වගේ. The child being the only child in the family. True or false?
False.
False.
False. When you are the only child, you get a lot more attention. So the amount of abuse and neglect that you can face is less. Poor parental knowledge and parenting skills. True or false?
True.
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 Which of the following statements poor? ඒක තමයි. ඒතර ගහන්න නැතුව හිටපුවම හොඳයි නේ. right. ඒතර මේක false නේ. දේශබන්දු concise එකේ මේක තිබ්බේ නැහැ නේද?
KB තිබෙන්නේ මාර පිටිපස්සෙන් බැලුවා මේ එකක් තිබ්බේ නැහැ මට හම්බුනේ නැහැ.
Right. 20. Which of the following statements regarding septic shock in the pediatric population are accurate? Fever is an essential criteria for pediatric sepsis. True or false? Fever?
False. False.
False. Why?
False.
Hypothermia.
Yeah, in neonates and in immunocompromised children, the fever will not be there, right? Serum lactate levels indicates the severity. True or false?
True.
True. What is the usual serum lactate level that is taken as the cutoff for severe sepsis? More than 3 millimoles per liter. Corticosteroids are routinely used in the management. True or false? True or false? False. These are used.
Adrenaline.
Yeah, these are used in refractory septic shock. Refractory shock, when vasopressors are used, only when vasopressors are used, usually hydrocortisone or corticosteroids is given, right? Early administration of adrenaline infusion is beneficial. True or false? Early administration.
False.
False. You need to give it only when the fluid boluses are ineffective in maintaining hemodynamic parameters. Not, you don't give it routinely as an early thing, right? It is characterized.
septic තියෙන නිසා අරුණජ මේක septic තියෙන නිසා එක මේ prove වෙන්න බැරිද?
What?
This is septic shock, no?
Yeah.
Then it can't be true වෙන්න බැරිද? Septic shock කියන නිසා normal shock.
In all patients with septic shock, you don't need to give adrenaline. You can manage it fluid boluses if you can manage the patient with fluid. But if the patient is refractory, that means you have gone over the fluid quota for that patient and still the patient's blood pressure is not picking up, then of course you will have to go for vasopressors. So there are early vasopressors is an important step, but it's not a part of the initial management. Understood?
Right. Oh, yeah. Thank you.
It is characterized by hypotension and bound impulse. True or false? True or false? Septic shock? True. What else do you get? You can also get warm peripheries. Usually in shock you get cold peripheries. In cardiogenic shock, in septic shock you can get warm peripheries. You can get a tachycardia, and then you can get also hypothermia. And then if it is due to something like meningococcal sepsis, you can get a purpuric rash. Understood? These are the other clinical features of septic shock. Okay, we have the SBS. SBS take a next day. Do you guys have any questions from what we did today?
Arunaja,
Yeah.
can you please explain the 20B? I didn't understand, like.
20B.
Yeah.
All right. So usually, when the septic shock is going on, when the septic shock is going on, it leads to hypotension. No? So this
Yeah.
leads to reduced perfusion of target organs. When there is reduced perfusion of target organs, the cells in the target organs, they produce lactate from anaerobic metabolism. Understood?
Yeah.
So that increases the lactate level. Us humans have a lactate level between 1.5 and 3, you and me. But if it is more than 3, that indicates severe sepsis. Understood?
Okay.
So that is why I said the serum lactate level can be used to indicate severity in septic shock.
Okay. Got it. Thank you.
Okay then, shall we call it a day today? We have discussed for 45 minutes. I can go ahead with the other ones also, but we'll go slowly. We have time now. You study all the parts in relevant to the MCQs and come. Because this will most likely be, the MCQ we get now will most likely be similar to this MCQ. That is why I'm also taking time slowly and discussing. Next week, sorry, not next week, tomorrow we'll be able to quickly go because these are SBS. No? Within this week, we'll finish the MCQ. Okay.
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 Thank you.
Thank you.
Thursday.